It's World AIDS Day, an opportunity to show support for those living with HIV and to commemorate people who have died from AIDS-related illnesses. It's also a chance for nations to reflect on the progress they are making in the fight against the pandemic. South Africa has the biggest and most high-profile HIV epidemic in the world, with more than 7 million people living with the disease. More than 100,000 South Africans died from AIDS-related illnesses last year. The country has made huge progress since 2000, when it had just 90 people on treatment. Today, South Africa has the largest antiretroviral treatment program in the world. It costs $1.5 billion every year to bring life-saving treatment to 4 million people in that country. Despite giant strides elsewhere on the continent, the United Nations says Western and Central Africa are lagging behind in the fight against HIV/AIDS, with 2 out of 3 people in these regions not accessing treatment. Now, the United Nations hopes to wipe out AIDS by 2030. A new report by the world body shows there are remarkable progress in many parts of the world, with a significant rise in access to treatment. But can the UN really end AIDS in the next 13 years? VOA's Carol Pearson spoke to one of the world's leading scientists about whether that is possible.
Since the 1980s, when AIDS was a death sentence, Dr. Anthony Fauci has been working to end the pandemic. Now he says we have the tools to do it.
What I mean is that we have extraordinarily effective drugs. But recently, those drugs have been shown over the past few years not only to save the lives of the people who take the drugs, but also to bring the level of virus in an infected person so low, below detectable level, that it makes it virtually impossible for that person to transmit the virus to someone else.
Drug therapy is now simplified, and many people in developing countries have access to the most recent drugs. We also have Truvada, a drug that prevents people who don't have HIV from getting it. UNAIDS reports that more than half of all people living with HIV are getting treated, but another 16 million people infected with the virus are not on medication. Many of them don't know they have HIV, so they pass it on to others.
In order to get a durable end to the epidemic, we would be greatly helped by an HIV vaccine.
A vaccine trial in Thailand proved to be 31% effective.
Can you take a deep breath?
Compare that to the measles vaccine, which is 99% effective. Can scientists develop an AIDS vaccine that is that good?
I don't think we're going to get there with an HIV vaccine, but even a vaccine that's 50, 55, at the most 60% effective, together with the implementation of the other advances we have, I believe we could turn around the trajectory of the epidemic and essentially end it as we know it.
Another vaccine trial is taking place in South Africa. The results won't be in for a while, and there's no way of telling if it will be good enough to help end AIDS. In the meantime, more people need to get tested and have access to health care. UNAIDS reports that in sub-Saharan Africa, new HIV infections have fallen by half since 2000. But in Eastern Europe and Central Asia, HIV infections have risen 60% over the past several years. Both Fauci and UNAIDS say ending the pandemic is up to the global community and how much effort and money it's willing to commit towards this goal. Carol Pearson, VOA News, Washington.